All right, welcome students. Thank you so much for joining us. This is Pre-Health Shadowing, which is a student-led, student-based, nonprofit organization focused on making shadowing opportunities readily accessible to pre-health students via our online platform during this global pandemic. Thank you all for joining us today. A few housekeeping things before we begin, but first, I want to know where you guys are all Zooming from. Pre-health shadowing allows students from not only places in the US, but all over the world to come in one place together and learn about different health careers. So go ahead and drop in the chat. Wonderful, welcome everybody. So like I said, a couple housekeeping things. We do send out an email on a weekly basis, once a week, with all of the virtual shadowing sessions that we are hosting for that week. So if you want to get all of the registration links and the meeting IDs, definitely make sure you are subscribed to this. You can do so by going to prehealthshadowing.com/join us. Once you do that, you're going to want to check your email and make sure that once you find pre-health shadowing, you might have to spotlight search it. Might have to find in your junk folder or your spam folder, maybe even your promotions folder. But once you find pre-health shadowing, go ahead and mark our emails as important. You're also going to want to save pre-health shadowing as a contact, and this will just ensure that it bypasses all of those initial folders and it goes directly into your inbox where you can find it in the most efficient manner. We also do get some perks. So part of being pre-health shadowing, which is our nonprofit student-led organization, we do get to collaborate with some wonderful companies that we get opportunities that we can share with you guys. Some of them are free and some of them are super heavily discounted. So I have some coming up. Be sure to check them out. We do have closed captioning for all of our live sessions to accommodate students with hearing disabilities. Part of pre-health shadowing is making accessible opportunities for anyone who is interested in going into the healthcare field. Alrighty, so our first opportunity that we have for you all, we have partnered with Mask for Mask, which is a woman-led organization, which for every 4 masks that are purchased, 4 are donated to someone in need, whether it be a hospital that is lacking in resources, or people in the homeless community, or anyone who just cannot provide for themselves during this global pandemic that we are currently experiencing. They have a bunch of different designs, and you guys can get this, for yourselves for gifts. And if you use our code PHS15, you can get 15% off of your order. They have donated over 40,000 masks in the past 4 months, which is amazing. Definitely consider helping out with this. You're helping 2 great causes. Not only are you helping donate masks, but 10% of all proceeds from this purchase will be donated to pre-health shadowing to help keep us free and open for all students anywhere. Check out their website, maskformask.com. We have also partnered with FemHealth, who is holding a FemHealth Purpose Summit, which is a year-long subscription and access to 19 founders, CEOs, and leaders in healthcare. You can have the opportunity to meet with these multi-million-dollar business owners. Some of them have been on Shark Tank. These are women who have made big strides in the healthcare field. And so if you guys are interested in learning about all of the insight that they have or any advice that they have, definitely sign up for this. Normally, this is a $50 value pack, and we have partnered with FemHealth to present it to you for only $29 today. Be sure to use our code. You will also be helping out pre-health shadowing in the process. So if you guys are interested, this is $29 for a year-long subscription, or over 19 founders, CEOs, and leaders in healthcare. So if you guys are interested in healthcare, being a leader in healthcare, anything like that, you have to check this out. All right, this is another great opportunity. If you guys, anyone is taking the MCAT soon or any standardized testing, we do have a form that you guys can fill out. If you fill out this form, you will get free access to resources like study guides sent to you. This is wonderful. You'll also get a 10% coupon code off for Kaplan courses that you can use on various courses. We will be in the short future holding a scholarship contest where a student can win a $2,500 Kaplan course scholarship. If you guys are interested in this, make sure you're following us on Instagram at Pre-Health Shadowing. So for now, if you guys are interested in getting some free study guides, there's some in there for like OChem, just all of these like practice tests, all the classes that we're either having to take now or going to take in the next few years. Be sure that you guys have this. Super awesome. All right, pre-health shadowing. If you guys are interested in getting published, we now have opportunities for that. We actually have our editor-in-chief in here with us today. Muntaha, if you want to give us a little wave. But we are taking submissions for articles, reflections, reviews, and success stories. This is an exclusive opportunity for our live session viewers, so you can only view this from the URL in the website. You cannot get to this from the main menu. So if you're interested in potentially getting published on our website, you can add this to your resume, your CV, your application, your LinkedIn. Go ahead and copy this link here at the bottom or click the link in the chat, prehealthshadowing.com/blog-submissions. This is the only way to submit your work. If you guys have any questions about that, feel free to direct message Muntaha. All right, Pre-Health Shadowing is starting a podcast. If you guys are interested in being on the podcast team, this is something that's very new. We are taking lots of ideas, and we hope you get students from all different backgrounds that have different experiences, that are interested in different things, so that we can all have different insight for each episode. So if you guys are interested in being a part of our student podcast, you can sign up using this link, and you will potentially get an interview with our Chief of Student Outreach. Alrighty, I invite everybody in our live session today to pull out your phone. If you go to the camera, you're going to be able to scan this QR code that I have here on my screen. If you guys could please scan your computers, this will take you to a page on our website. This is called the Donate page. So as Pre-Health Shadowing is a student-based, student-led nonprofit organization, we rely solely on the contributions and support from our community to ensure that we can stay free for everybody. So we are currently struggling financially, and we're reaching out to you guys, our live viewers, to help us keep us alive. We are working to fight inequity in health education and promote diversity in the various fields. So help us out with this. You guys can be the change that you want to see in the world. We are in a healthcare worker shortage at the moment, and it's only getting worse due to COVID. So if you are financially able at this time, please consider donating, $1, $5, anything helps to keep our website up and making sure that it doesn't crash when you guys are trying to take your post-shadowing assessments to get the certificates to verify your virtual shadowing hours. Of course, we understand we're all pre-health students and we might not all have money to give right now. That's totally understandable. If you cannot donate today, we ask that you share this link with 5 people who you think might be able to donate, whether this be family, friends, professors, anybody who just wants to see you thrive that might have a little couple extra bucks in their pocket. We really appreciate anything you guys can do to help us keep us free and accessible for everybody. Alrighty, if you guys are looking for a mentor, we do have a mentorship opportunity coming up for you guys. This is 100% remote, and you have the opportunity to meet with up to 6 established professionals. So this is a 3-day event. This will be taking place on February 19 to 21. And you'll have the opportunity, like I said, to meet with up to 6 professionals, potentially in your field of interest. And this is by invite only. So if you guys are interested in participating in this is how you gain an invitation. You are going to download the materials from our Google Drive. You're going to register as a volunteer, post those pictures on your social media, maybe adding like a little personal video or a personal comment in there. And once your bingo board is all filled up, you can submit it to the Pre-Health Shadowing website to gain your RSVP link. It is that easy. So if you guys are interested, the deadline is coming up. It is due January 31st. So it's just a few days from now. If you are interested in participating, you are more than welcome to fill up your entire board. Something that I do recommend if you are looking to fundraise the money is sending it out personally to people and adding a little personal touch and being very direct with what you're asking for. You'll get a lot more responses that way. So if you're interested, if you have any questions about that, feel free to email us at volunteers@prehealthshadowing.com. If you are interested in helping out, Pre-Health Shadowing is a student-based organization. You can become a student volunteer. You can help out both asynchronously and live in real time with students all around the world. Or you can also become a Pre-Health Shadowing team member, which is a leadership role within Pre-Health Shadowing. And you could potentially lead a group of anywhere from 5 to like 150 volunteers. So if you're interested in that, be sure to check out our website. I will go more in depth with this at the end. Also, if you're a high schooler and you're interested in getting involved, we have opportunities for you as well. We have started a new program within pre-health shadowing called HTP, and you guys will be working to establish pre-health shadowing as a club on various campuses across the US. You guys will have the opportunity to network with like-minded high schoolers who are interested in your potential field of interest. So if you guys are looking into HTP, feel free to sign up on our website the same way you would for our student team, and we will be sure to follow up with some more information. All right, if you're joining us for our live session today, go ahead and post that on your social media. You can tag us at Pre-Health Shadowing for an opportunity to get reposted on our official page. For today, go ahead and post your setup today. How are you watching our virtual shadowing session? Go ahead and let us know. Tag us at Pre-Health Shadowing on all of our social media. With pre-health shadowing, students can take the post-shadowing assessment to receive a certificate that will verify their virtual shadowing hours with us today. I encourage you guys to take good notes and ask our professionals some wonderful questions. And feel free to drop those questions throughout the chat. Through the entire duration of today's presentation, we will be sure to document your questions and ask them during the Q&A portion of today's session. And without further ado, I would like to present to you our guest speaker for today. Thank you so much for joining us. You are, I believe, our first occupational therapist, so welcome. We're so honored to have you.
Yes, thank you so much for reaching out to me. I'm so proud and happy to represent this wonderful profession called occupational therapy. And hello, everyone. My name is Johan Gutierrez. I am a board certified licensed occupational therapist. And today we're going to be talking about all about OT and what this is all about. All right. So here we are. These are our objectives for today. We're going to be defining occupational therapy. Like, what is it? Do we help people find jobs?
Really quickly, you want to go ahead and share your screen?
Oh my gosh, what the heck is happening? I don't even know what you guys are seeing.
Okay, I'm going to go ahead and put out one of our polls. Students, feel free to answer this poll. We're going to leave it open for a couple seconds. It is multiple choice, so you can answer all of those that you think apply. Wonderful. If you have not yet submitted your response and you would like to, go ahead and submit it quickly. All right, well, awesome. All right, I'm gonna go ahead and let you guys take a look around the room. What do you think, Joanne? How'd they do?
Let me see, first one is, wow, interesting. That's a very common misconception that occupational therapy helps people find jobs. So we're gonna be talking about OT and what it means. Are we able to see my screen now?
Yes, looks good. Thank you.
Perfect. Thanks so much. So these are our objectives for today, including the definition of occupational therapy, our historical background, our scope of practice, the settings and populations, any certifications and specializations we can get into, what's the differences between physical therapists versus occupational therapists, because we do have a lot of confusion between them, salary rates, advocacy and awareness, and typical days in OT, and etc. All right, so before we get started, I want to introduce myself. My name is Joanne. The H is silent in my name. I am born and raised here in Los Angeles, California. And I am a Filipino American, which means that my parents were from the Philippines and then they immigrated here to the US and had me. And I am a first generation college and grad student. So I was the first in my family to go to college and pursue higher education and go to grad school. I went to occupational therapy school at a Los Angeles university called West Coast University. And I graduated with my master's degree in December 2019. And that's where I got my master's degree. And the special interest that I love working with my pediatric population. The specialties I cater towards are children that are diagnosed with autism, sensory processing disorder, eating difficulties, or any neurological impairments. Um, Also, I do home health. So not only am I physically at a outpatient setting, but I also go to the family's homes to provide occupational therapy services. And here's my personal journey. I For those who are interested in OT, I don't want you to compare your journey or your timeline to mine. I believe everyone has their own destiny and their own journey. So you can just use this as a simple reference, but please don't compare yourself. I discovered OT at the age of 19 years old. I actually wanted to be a preschool teacher when I attended undergrad. And I discovered it through a family member that was receiving occupational therapy services. And when I saw it happen, I was like, yo, that's a job for me. It's fun, it's innovative, it's flexible, and we get paid pretty well for having such a fun, amazing, creative job. So when I was in undergrad, while getting my bachelor's degree to prepare for grad school, I worked 3 different jobs because I knew grad school was going to be expensive. As some of you may be like, I don't know, having some student loans. I'm part of that club. So I worked 3 different jobs to save up money. I also completed prerequisite courses to get accepted into OT school, because when you get into any grad program, there's certain prerequisite courses you must take. And also, it took me 2 years to get into OT school. So I didn't get in my first try, but I didn't let that, drag me down. Your girl persevered, applied a second round, and got in. So I encourage you, if you get a rejection letter from any program you get into, just keep trying and don't ever give up on your goals. My accomplishments while in occupational therapy school, I was the PR chairperson for 1 year. So I was in charge of the social media of my program. I also co-founded a wellness committee talking about mental health for grad students. I'm also the creator of a social media trend called #YOT Wednesday, where we talk about why we love and chose OT. And also, I was a autism committee member for the state of California. And post grad, after I graduated from occupational therapy school, I created another social media trend, creator of #collaborate with OTs, where I talk about how occupational therapists collaborate with different interprofessionals like physical therapists, doctors, PAs, speech therapists, and etc. I'm also a mentor for pre-OT and OT students, and a co-TAD mentor, which is talking about diversity within our profession. I also wrote a pre-OT book, which is the screenshot that I have there, talking about how to get into OT school. And I wrote that during the pandemic last year. And this book actually really helped a lot of pre-OT students get into OT school. So this one's like my baby. And also, I am a newly selected Autism Speaks volunteer advocacy ambassador for California. So that's a new job that I have. And as you can tell, autism is one of my passions, to passionate populations to work with. So now let's define what is occupational therapy. Misconception is, oh yeah, we work with fine motor skills, or we only work with the upper extremities only, or we help people find jobs. Well, I'm here to break it down. What is occupational therapy? So according to American Occupational Therapy Association, which is our national association, occupational therapists and occupational therapy assistants help people across the lifespan participate in the things they want and need to do through their therapeutic use of everyday activities, also known as occupations. So what does that mean? Well, let's break it down. Occupation, what is what word is within, the term occupation? It means occupy, right? So we can ask ourselves, what are some activities that occupy my time? Or, that could be anything. It's completely subjective. It can be like simply as, cooking, taking care of kids, dressing, brushing our teeth, um, um, you know, uh, gardening, dancing. It's literally any occupation or activity that preoccupies you. Us therapists can help you engage in those meaningful activities again. And super common words that OTs use a lot, we use the terms holistic, client centered, purposeful, and meaningful because as occupational therapists, we cater to our clients or patients so much. So when we ask them if they came from, say, a car accident, and I have a 50-year-old patient, and I tell them, like, sir, I know you experienced a car accident, tell me, like, what is your role? Is he a dad? Is he an uncle? Whatever it is, what were some of the activities that you did and you enjoy doing? Maybe he might say, oh, like, I know I need help getting dressed for work. I need help brushing my teeth, brushing my hair. Whatever it is that's meaningful to that patient, as occupational therapists will help them regain those skills to gain independence. And some history of occupational therapy for those who love history. We actually took place in the 1800s, and not a lot of people know that because, like, they're like, what the heck is OT? But we've been around for quite a while. We actually originated from mental health, and we actually helped people during, I think it was World War I or World War II. Don't quote me on that. But our roots are mental health, and we actually helped people, those who had mental illnesses that were in asylums and in prison. And while the people that were in the asylums, we helped them engage in meaningful occupations such as like doing arts and crafts, sewing, crocheting, anything meaningful to them to get their mind preoccupied. Oh, so here you go. Wow, Joanne. You wrote the history. So it actually took place in World War I. So that's when we were developed. And we weren't even called occupational therapists. Our original name was actually reconstruction aides. So we, as reconstruction aides, we help the US soldiers with any mental or physical challenges. And like I said, we originated from our arts and crafts movement during World War I. And then we then transcended to performing our activities of daily living, which is the ADLs, and IADLs, which is instrumental activities of daily living, which I will be talking about soon. Here is our scope of practice. This is our bread and butter. This, if you are wondering what do OTs work on, girl and boy, like this is it. We focus on these occupations. Like I was saying, activities of daily living, which is bathing, toileting, grooming, that we take for granted on the daily basis, and OT helps you with that. And IADL, which is grocery shopping, taking care of our pets or kids, financial management, or taking care of the house. We help with that as well. We also work with sleep. Like I have patients, since I work with pediatrics, parents tell me like my 2-year-old wakes up in the middle of the night, like at 3 a.m. and he only like his sleep is disrupted. How do I make my child establish a healthy sleep routine? Us occupational therapists can help with sleep as well. We help with education, work, play. Like, for example, I work with kids. So a lot of the interventions I do with my kids is all through meaningful play. We also help with leisure. So any activities, hobbies that you love doing, especially right now in the pandemic, finding a leisure activity. We help you discover new leisure fun activities to do. Also, we help with social participation. We teach people how to socialize with their friends or their peers, especially if, like, say you have a mental diagnosis. We can help you learn new social skills. And here is a lovely graph I provided of where occupational therapists work at. I love being an occupational therapist because if I say I'm bored of my setting, I work in outpatient and home health, right? I can literally hop into any setting I desire. I can become a professor. I can work with early intervention kids, which is children from 0 to 3 years old. I can work in any outpatient setting, inpatient setting, home health, hospital setting, mental health, skilled nursing facilities, or schools. So we literally are everywhere. And this chart I have provided, you can see that majority of the population of OTs work in the traditional setting of hospitals there, with the latest stats I found was in 2014, which is about 26%. So if you're interested in these practice settings, like, we have a variety. And now I want to talk about our non-traditional practice settings, settings that people didn't even realize OTs can work at. So you can be an OTpreneur, meaning like an entrepreneur like myself, like creating resources for families, OT students, or pre-OT students, you can work in academia, so you can be a professor and teach OT students. You can even be a private health coach. I can also work as a home modification specialist, meaning like I can go in home to the family, or say like my 89-year-old patient, and modify their homes to decrease falls and increase safety awareness. I can sell medical equipment like wheelchairs, or specialized controls and functions for their wheelchairs, or if they need a shower chair or a shower bench, I can sell that. I can become a case manager. I can also practice as an assistive technology professional, as the top picture is listed. That's a woman in a chair, a specific assistive technology wheelchair, trying to help her engage in her occupation. I can become a driving rehab specialist. So that picture in the bottom, if you see there's like knobs and certain switches there, usually spinal cord injury patients who want to drive again. As an occupational therapist, I can become a driving rehab specialist and modify and adapt their car for them. I can also work in community-based mental health, which is one of my favorites. And also we can do ergonomics. So we can assess, say, an office worker, provide proper positioning and proper ergonomics. So we can practice in these non-traditional settings. And another popular question is, who do we work with? We can literally work with anyone from across the lifespan, from newborns up into beyond 100 years old. It doesn't matter. We help with everyone and anyone at any age. Like, personally, my youngest patient I have is 4 months old, and what you're thinking, like, hey, OTs, what do you work on with the 4-month-old? Well, if you think about it developmentally, maybe this newborn needs to learn how to roll. We're working on how to roll from, side to side. Maybe we might even help with like visually tracking and see like their neck range of motion. So we can work with like the youngest and tiniest clients up into like, I don't know, your oldest client. And also we work with any type of illnesses, disabilities, diagnoses, traumas, or injuries. It doesn't matter what you have, because as occupational therapists, we don't see your diagnosis. Just because you, experienced a traumatic incident, it doesn't matter, because we're going to look at you as a holistic individual and ask you, what are your meaningful occupations and how can we regain those skills for you to be independent again. And I love this disclaimer I have. We always treat the client not based on their diagnosis or disability. Here are some additional specializations and certifications occupational therapists have in case you're curious. So we have gerontology, mental health, pediatrics, physical rehabilitation, driving and community mobility. So like I was mentioning earlier, like becoming a driving rehab specialist. We can even become specialized in environmental modification. So remember I had that example about like the 89-year-old patient who's constantly falling in their house. We can modify their home for them. Or even if someone's wheelchair dependent, we can modify their homes to maybe have a ramp in their entranceway. We can also become feeding, eating, and swallowing specialist. I know speech therapists are also swallow certified, but occupational therapists also can become certified in that specialty as well. We also can be low vision specialists. So that's like that picture I have below, that bottom picture. We can specialize in low vision. We can become a certified hand therapist, as the middle picture I have there. Because with hand therapy, it's such a complex specialty that because there's like so many things that involve our hands. So typically at like a hand therapy clinic, we could see people who have maybe like have carpal tunnel syndrome or de Quervain's syndrome, tennis elbow, like all these different hand conditions or orthopedic conditions. Us OTs can help, regain functions within the hand and upper extremity. Additional certifications and specializations we have are certified lymphedema and wound therapist. I think this one's super dope for lymphedema management. We can also become assistive technology professionals. We can even go into aquatic therapy. So if you're wondering what that is, like if you look at the word aquatic, so yes, we're going to be in the swimming pool doing therapy in the pool. We can also do IASTM, which is instrumentalized, I forgot the whole term, but basically it's like soft tissue management, and it's the picture that I have there in the bottom. It's like using like this Graston technique. I'm not really I'm not certified in that, but I do know a little bit about it from OT school. So you can become certified in that. I know it's really popular, especially for like athletes, or even like those who constantly exercise a lot. Like if you are interested in the sports realm, like IASTM is definitely one for you. Kinesio taping, like I have the picture on top. We can specialize in kinesio taping. We can even become certified brain injury specialists. So for all those neuro people, you can specialize in this as well. We can do infant massage, be a lactation consultant for the moms. We can even do amp care, which is for our patients who have amputations. And we can also do SOS feeding, which is a certification in feeding for those with sensory needs. So what is an occupational therapist? Like, what is our role? So my proper title is OTR, Occupational Therapist Registered. So these are the roles that I, as an OTR, would have. I do evaluation. So I get a referral from the doctor saying that, whatever the report says, and then I would do an evaluation on my patient. And then I would, interpret and gather some data results based on my evaluation. And then I can create intervention plans and write goals for the patient. I can also supervise codas. And I think I have a slide what a coda is. It's basically our OT assistants. And then I use my clinical reasoning skills to continue, modify, or stop OT services for my client. I guess I don't have what quotas are, but basically a quota is it stands for Certified Occupational Therapy Assistant, and they're assistants to the OTs. And the difference is that they're still OTs, they can still see the patients, treat them and stuff, but the only thing they can't do is they can't do evaluations and they cannot supervise. And for the education, they need in the US, they require an associate's degree versus an occupational therapist register like myself, you need a master's degree. And what is the difference between physical therapist versus occupational therapist? Well, we heavily collaborate with each other, right? And oftentimes we get intermingled in the mix, but I love our physical therapist. I do a lot of co-treatment with the physical therapist at my work because we do share the same patients, which is amazing because you get their own unique clinical perspective of how they do certain things, and then we can collaborate on our goals for our patient. So according to the American Physical Therapy Association, physical therapists are movement experts who optimize quality of life through prescribed exercise, hands-on care, and patient education. Their specific duties include promoting the ability to move, restore function, decrease pain, and prevent loss of mobility. And as for occupational therapists, we help people do things. We help people, like I said, engage in those meaningful occupations. And, both professions are very active professionals and we heavily collaborate, like I said before. But the main difference for OTs is that we help people engage in any meaningful and functional activities to regain the skills and independence. So for those who are interested in pursuing occupational therapy, this is a very common interview question. So write this down, save this slide, and really try to understand what is the difference between PT versus OT. And I also want to talk about the interprofessional team because I believe working as a team for the betterment of our patients, produces amazing outcomes for them. So what does interprofessional mean? It defines as involving two or more professions. So for example, at work, I heavily collaborate with our physical therapist and our speech therapist. They have their own unique responsibilities as a clinician, and I'm able to get their perspective on things. For example, I have a patient who is about a year and a half. He doesn't walk yet, and developmentally by the age of 1, you're supposed to be able to walk independently. But, there are some neurological concerns and genetic disorder that he does have. So he is delayed. And since he doesn't know how to walk, I ask the physical therapist, what are some goals that I can achieve to help with maybe dynamic standing balance, maybe some core strengthening activities. And with the speech therapist, I collaborate with the expressive language component because I'm not a speech therapist. I don't know how to maybe assess how to understand the patient through their communication skills. And also here, the qualities of an outstanding interprofessional team, I have listed, of course, open communication, being respectful towards one another, great, amazing teamwork, being very well organized and goal oriented. So who can occupational therapists collaborate with? So of course, we heavily collaborate with our clients/patients, definitely our families and caregivers, right? We also work with the doctors, so physicians or PAs. We work with nurses, especially if you're in the skilled nursing facility setting or hospital setting, you're constantly going to be asking the nurse, how was patient so-and-so? Are they ready to get out of bed? We work with our codas, like I said, our PTs/PT assistants, speech therapists, our teachers. If you're an OT that works in the school setting, you're going to be heavily collaborating with the teachers. We collaborate with ABA therapists, social workers, and respiratory therapists. And another common question is, what is the salary rate for occupational therapists? And I have here a statistic from the Bureau of Labor and Statistics. And keep in mind, this is the national average of the median annual salary in the US, which is about 83 grand a year. And how much do new grad OTs make? So according to the American Occupational Therapy Association, the median salary is about 59 grand per year. But of course, this is nationally. This does not mean per state. So if I'm from California, $59,000 might not be it. It might be something else. So keep in mind that this is a national rate for new grads. And like I said, each state varies based on salaries, right? Even like each county varies. Like I'm from Los Angeles County. If I go to Orange County, for all my LA people or California people, Orange County, they get paid differently there. So it's interesting how salary rates work within the US. And I have another stat from both Glassdoor and salary.com. How much do OTs make here in Los Angeles? So it's like about roughly 71,000 to 110,000 per year. And another stat I got was about 84,000 through 120,000. And the reason why there's different salary rates is because it depends on the setting and population you work in. So for example, I'll tell you this, like if you want to make a lot of, or be more lucrative as an occupational therapist, the most lucrative setting is the skilled nursing facility because because in reality, everyone's getting older and older and older, right? So now we need OTs to help with these older adult populations. So that is a lucrative setting. If for those who are, in it for the money. I'm personally not in it for the money. I really, really love my population and my profession. So that's an interesting stat in case you were wondering. So there's that. And I want to talk about advocacy and awareness because I feel like, especially in this current climate, we need to push for change. So I have here, according to AOTA, which is our National Professional Association, our mission statement is to advance occupational therapy practice, education, and research through standard setting and advocacy on behalf of its members, the profession, and the public. So that's their mission statement that we have. So how can we push for change and start in, the betterment for our organization? I have, of course, here, pushing for legislation, setting up safety standards of practice, advocating for our profession and clients and the health disparities, especially in our communities, especially within like the LA County, there's a lot of health disparities within our communities. So how can we start these changes that way the health disparities in our communities can have equitable and accessible healthcare? Also, we can educate others on the importance of occupational therapy. Like I said, our profession doesn't really get a lot of, light. So that's why it's important to educate others about what is occupational therapy. And this is why I do a lot of speaking engagements, because I want everyone to be aware of how amazing and how profound our profession really is. And also diversify our profession. There's a stat actually that about 82 or 84% of occupational therapists are Caucasian. And I think for Asians, it's about 6%. And I think Blacks are like about 3%. So that speaks volumes. So we really, really, really need to strive to diversify our profession. And I think with pre-health shadowing, with this organization that you guys wonderfully established, and having, advocating and shedding light about occupational therapy, and then even announcing it to like the high school students at a younger level. Like, that's so amazing. So, it all just starts from somewhere, and I'm glad that this organization was established. And so now the fun part. In case you guys are wondering what my typical day is as an outpatient OT. So I arrive to work approximately 8:30 to 9 a.m. depending on my first patient that comes in. I read their charts or past therapy notes. So like if it's a patient that I've already been seeing for like the last couple months, I look at the past notes that I documented. What are the things that we worked on last time, and then what should we continue on for this session. However, if it's a new patient, then of course that's a different story. I have to start from scratch and see what their baseline is, and ask for the families, what are their current concerns at this time, to make goals for the client. Also, after I read my notes, I set up my therapy session. So, okay, what are some things that I'm gonna need for my patient? And then the next one is, at least for my setting, every setting is different. I would provide 50 minutes of therapeutic services to my patients. And like I said, each setting is different. So some places are gonna be 30 minutes of OT, maybe even 15 minutes, 50 minutes, or an hour and a half. It varies per setting. After the therapy is over, I provide a lot of education to the parents, because like I said, with pediatrics, you are heavily collaborating with the parents / caregivers of what are some strategies that they need to do at home. So after the patient and the family is gone, I go into my office, then I document everything that we did during our session, and then I sanitize and clean like all the stuff that we've used, and then I repeat the same steps 7 to 8 times, since I see about 7 to 8 patients per day. And I took some pictures of a sensory integration therapy gym, and you guys can see that we have a ball pit, we have a yoga ball, we have swings, tunnels. Honestly, my job is so fun, but I work at a specialty clinic, so a sensory integration gym. So not all outpatient pediatric settings look like this, but since I work in a specialty clinic, this is how my work environment looks like. And it's so fun because I get to work for 8 hours going on swings and ball pits, and like, who wouldn't want that as a job, right? And so for those who are interested in going into OT school, I have here the admissions process. So take notes of this, guys, if you're interested. You first need to graduate with your bachelor's degree from any major. So if you're an art major, anthropology major, dance major, like, it don't matter, just get your bachelor's. After you complete that, you are required to take the prerequisite courses, depending on the program that you want to enroll in. Each program has their own specific prerequisite courses. So not all of them are cohesive, unfortunately. So you really need to do heavy research on the program you're interested in and see what prerequisite courses they require you to take. Another one is called the GRE, which is a graduate record examination. It's a standardized test that some programs require you to take, so it's optional. So like I said, do your research of the program if they require this. My particular grad program didn't require the GRE, but I know some schools do. Another one is an interview. You may be invited to an interview invitation, so an interview may take place for you. Another part of the admissions process is that to volunteer in various settings. So for example, if you're already set on like working in the acute care floor to get into OT school, like, that's not going to cut it. You need a variety of settings because OT schools want to see that you are generalized. And like I said previously, OTs work with people across the lifespan. So it's important to, get a general feel for everything. Also, you need letters of recommendation, and also, of course, write an amazing personal statement and also apply to your desired programs. We're almost done, guys, I promise. And so here are some advice that I have for pre-health students in general. So apply for leadership positions. If you're the timid, shy person, just wants to be a member, like that's cool. But, it's also important to, speak up and, do something different. And if you want something to change, apply for it. And if you lose, like, who cares? At least you tried, right? So I am very adamant about people taking on leadership roles. Also, starting your own initiatives. If you feel like there is a need or gap in something, start it. I know, like, from my undergrad program, there wasn't like a pre-OT club, but then, like, I think last year, my undergrad university established a pre-OT club, and I was like, wow, that's amazing. That's something I wish I had. Another example is starting your own initiative. Like when I was in OT school, I felt that there was a need for mental health care. So that's why I co-founded the wellness committee for my graduate school. And another one is volunteering in various settings, like I previously mentioned. Another one is having, of course, a very strong personal statement. I have a tip here for personal statements. Always show, don't tell. You want to be as specific as possible because you want to be able to paint a picture for the reader. Since I'm a pre-OT mentor, I've actually edited like hundreds of personal statements for those who are trying to get into OT school. So I provide a lot of specific, accurate feedback of what the admissions committee wants to see. So if you have personal statements for OT school, feel free to email it to me. My contact information is in the last slide, so don't worry. And then, of course, the last one is advocate for diversity and inclusion efforts, because especially as a pre-health student, right, we want everything to be as accessible and as inclusive as possible for our patients. So here are my references. And that's about all. Before we have our questions and answers, feel free to take a screenshot or write this down. This is my contact information. I do have a website for my pre-OT students called www.missjoanneot.com. And then here's my Instagram handle below, missjoanne.ot, where you guys can follow me. DM me because I always reply and stay connected with everyone, and also my email address for other questions and inquiries. All righty, everyone. So that's about all. What are some questions and answers you guys have for me?
Thank you so much for this amazing presentation, taking the time out of your day to do this. This is awesome. But the first question is, how has being an OT changed your perspective on life? And what is the most important lesson you've learned?
Ooh, that's a good question. Wait, so what was the first part of your question?
How has being an OT changed your perspective on life?
Okay. Oh man. Okay, it's kind of annoying that I do this, but I now like assess and observe everyone. Meaning, like, if I see someone eating, I look at, okay, how are they holding their utensils? Are they holding it appropriately? So I observe like literally things like that. If I see someone with like, say someone slouching like through, I don't know, through online school, I like tell them like, hey, can you fix your posture real quick? And also I don't know, I just literally assess and like observe every little thing in a person. Like I can't turn off my OT glasses. That's like what we call it, like turning on and off our OT glasses, because like I said, OT is everywhere. Like what occupies someone. So whatever you're doing, best believe if you're around an OT, they're going to be assessing and evaluating every little thing you do. That's a good question. Thank you. What was the second one?
It's what is the most important lesson you have learned in your profession?
Ooh, definitely the most important lesson I've learned is to just be honest and vulnerable with like towards your patients and families. A lot of the patients that I see are underserved, meaning that they have low income or they come from a, like a rough background, or they don't have a lot of resources available. So as an occupational therapist, I've learned that honestly, just being a human being and listening to them and giving them as much resources as possible and telling them that you are truly there for them is what I've learned goes a long way. And because just being human with them and just being there for them has really impacted um, not only like their patient's lives, but also like it developed a more meaningful relationship with my patient.
Thank you for sharing. What made you specifically interested in working with pediatrics, and what's the most interesting part about working with them?
Um, I've always loved pediatrics. They've always had my heart. Like what specifically about them is because they're so like they're still developing, right? They're still so young. So I feel like when you build a really solid, positive foundation with them, they're gonna create amazing strides. Um, what I also love about working with the pediatric population is because I have the wonderful opportunity to see their progress. I have patients I worked with for like a few months or like a few years, and I see the progress that they made from literally day one up until now. And I'm like, oh my God, like you never used to do this before. And now look at these amazing goals you've accomplished. And it's so wonderful as an OT to see them accomplish their goals, but also um, their families are also so proud because they see the tremendous progress and work their child has done. Oh, sorry. And how do I show my face so I can stop sharing? Oh, I guess stop share. There you go. Sorry.
Perfect. Thank you. The next question is, are the prerequisite courses enough to prepare you for grad school? And what are other ways that can help prepare us for the courses we will take in OT schools?
Yeah, good question, Isaac. So I believe not all prereq courses help you in grad school. For OT specifically, what helped was like the psychology, abnormal psych or general psych helped. Also, anatomy and physiology definitely helped. But the other BS prerequisites like physics, like you don't need that in real life. So don't waste your time in like taking non-essential courses. But anatomy and physiology, abnormal psychology, and general psychology really helped in grad school.
Thank you. Kind of along that line, did you have any work experience prior to going into getting your master's degree that helped you in OT school? And would you recommend anything like being a CNA, a rehab aide, or an RBT?
Yeah, definitely. So prior to OT school, I was an occupational therapist aide. So being a rehab aide definitely helps you in grad school because you get the clinical background, like how do I interact with patients, and also how to read charts and stuff. And I was also, it's called a DIR floor time specialist. I don't want to get into what that is, but I helped with, it was within the pediatric setting. So I was also that. And some awesome jobs that will help you in grad school, like what you were saying, Aster, like being a rehab aide is great. Even being a teacher's assistant would be awesome. Also, like a CNA would be definitely helpful because you're getting like the physical demands and skills of what it takes to work at at a hospital setting or outpatient setting. I also know people that were like secretaries / receptionists because you get that interpersonal customer service skills. I also know people that were babysitters / nannies for kids with special needs, so that's another good one. And also like childcare specialists as well.
Interesting. Thank you. The next question is, what has been your favorite memory so far in your OT journey?
Oh my God, I have so many. Well, like now as a practicing working OT, like this has been my ultimate dream come true. Like if you think about it, whatever your dream job was, and now you finally worked hard for it and now it's there. Like working as an OT has been like one of the best memories. Also, one of my patients recently got discharged because he met all of his OT goals, and I was crying, the mom was crying, because you just get so close with the patients and the families. And if that's something that you love, like having that close bond and relationship, like do it. That's what's so special about being a therapist. I also taught one of my patients how to walk for the first time, and best believe I was crying. So that's like another awesome memory as a working OT. But even during OT school, awesome memories I had was that being there for my classmates. I went to a very small program with 34 students, and we were very close. And I really appreciated like the intimate connections we have, because now they're my colleagues. So now I can like hit up my classmates that are now practicing OTs in different settings, like, hey, I have a hand injury, like what do I do? Or, oh, I know like my family member has like something with like neurological impairment. I can ask my friend, like who is a certified like brain specialist, like, hey, what do I do? So it's cool how like networking begins. And yeah, those are like the best memories so far. Thanks, Sam. I see you in the comment.
Thank you. You talked a lot in your presentation about diversity and representation, which I think is so important. I'm so glad you touched on it, but do you mind giving maybe some personal experiences to how your identity as a minority has affected your educational experience and your professional life?
Yeah, definitely. So at my current job, I'm the only Asian or Asian American in my workplace. So I like to share my cultural values and beliefs, and I also tell them about my culture, like Filipinos, and you know how we are, because we also have Filipino clientele. Filipino clientele too. So I share about that. In OT school, actually in my program, it was pretty well diverse. There was a good mix. So I know that like majority of the profession is Caucasian. It's a fact. You guys can Google it. But as a student, I felt that my program was actually pretty well diverse, because there were African Americans, there were Caucasians, there were Asians, and also Hispanics into the mix too. So I think my program did a great job in accepting students to have like a well diverse student program.
That's great. Thank you. The next question is, how did your university prepare you for working as an OT in the real world? And what's one thing that and what's one thing that you wish you learned in university to prepare you?
I'm just kidding. Of course it taught me stuff. Definitely like the hands-on application skills. I know it's so different because of COVID. Online learning sucks for a lot of students, but I went to school pre-Rona, so we did a lot of hands-on learning skills, like learning how to properly do safe transfers from bed to wheelchair, or wheelchair to bed. I've also learned how to like do like range of motion exercises, how to palpate for muscles, how to use different equipments like an ultrasound machine, how to splint. So the hands-on learning stuff honestly helps me more in the real world. And also in your programs, you have practical exams, meaning like you're given a case scenario, you read it, interpret it, and now you execute what you're gonna do. At my program, we had actors. So these are literally like paid actors as medical patients. and you don't know what you're going to have in your little prompt. So they can come with anything. And then you as an OT see that and you have to already know, okay, like what are some interventions I need to do? So the hands-on learning and the practical exams definitely helped me in the real world.
Thank you. That's really good to know. So how did you choose to get a master's of occupational therapy over going for a doctorate? Somebody mentioned that. I heard that OTDs may be mandatory in the future, similar to how physical therapists are now required to get a DPT. And would it be better in this situation to go for an OTD?
That is a great common question. I personally chose the master's route because of my lifestyle and life choices. The master's route is typically 2 years to 2.5 years. The doctoral route is about, like, depending where you go, of course, it's like about three years. And I personally chose to get my master's was because it's quicker, but we are going to get paid the same rate as an entry-level OT. So I have my master's, and say, I don't know, say Bob has their doctorate, we're going to get paid the same rate. It doesn't matter if you have your master's or your doctorates. Of course, like I said, it depends where you live, like what state and all that. But since we're both entry-level therapists that came, say, from the same school, we're going to get paid, and say we apply for the same job, we're going to get paid the same rate. Like, it doesn't really matter. The only difference between doctoral versus master's route is the doctoral route has like their capstone project. So they do more heavy research, more leadership and advocacy roles. So if that's something that you're really into, by all means do it, because we need a lot of more research, especially within our field. Also, to tuition price, I don't want to spend triple K thousand of student loan debt. So the master's route is cheaper than the doctoral route. What was I gonna say? But I have a lot of friends that have their OTD, so their doctoral in OT, and I have my master's, and we literally perform the same duties. It's the same thing. It's just a different degree and different title. And yes, it is mandatory in the few years to get your doctoral. I don't know what year specifically, but within a few years, I know that they are going to be now requiring OTs to get their doctorate degrees. I personally don't need it because I'm already grandfathered in.
That's awesome. Thank you. The next question is, how did you determine which OT school was best for you?
Good question. So it depends. You have to reflect upon your own lifestyle. And, do you want to stay at home or do you want to move? Do you also have the financial means and also be emotionally, physically prepared for all that? I also tell a lot of pre-OT students that also it's important to do like maybe a pros and cons list. Like, what are the pros of going into this school? What are the cons of going to this school? That's what I did. So that's what helped me choose. But I personally chose my program at West Coast University because I'm from LA. The school's in LA. So I didn't need to move. I could stay at home. I could definitely save money because OT school is expensive AF. So I did it for mostly financial reasons. And also I'm very, very family oriented, and I wanted to be close to family.
Thank you for that insight. Can you talk a little bit more about how you work with other healthcare professionals, like you mentioned, working with doctors and PAs and PTs? So how do you guys communicate, and how do you guys share the responsibility of caring for a patient?
Yeah, great question, Esther. So particularly in my current work setting, we don't have doctors or PAs, but I do heavily collaborate with the physical therapist. So how we communicate is literally just in person because we share the same office space. So I just say like, hey, how did so and so do? What worked? What didn't work? All right, cool, I'll try it. So that's how I communicate with them. But of course, same that my PT coworker isn't present, I can just look at the charts and just see, read what they did. So that's how we communicate. That's how I do it.
Thank you. The next question is, since you edited personal statements, what was the most common mistake you saw in them?
I guess just like well, besides like grammar and spelling, it's like the thoughts, like I could see where the student is trying to say, but then I'm like, yo, this ain't specific enough. You need to give me more details. So that's why I emphasize a lot, like, you need to show me what you did. Just because you cleaned the clinic doesn't mean anything. Like, why did you do it? And also, I'm sure you did a lot more things besides cleaning. Like, I was there too as a volunteer, like, yo, I'm just cleaning. Like, this is boring as hell. What, that's why it's important to take initiative, ask the therapist, ask whomever, like, hey, how can I help you? How can I have more like a better understanding of occupational therapy? So that's why just shoot your shot and take initiative. But I did see a lot in the personal statements, there was a lot of lack of details. So you really want to emphasize on painting a picture for your readers, because you're applying to a program that has hundreds of applicants. You really want to stand out.
Thank you. Kind of along those lines, for students applying to OT school, what is your best advice that you think would help them increase their chance of being accepted?
Diversifying your volunteer opportunities, like I've been mentioning, because that will speak volumes. And also having a really, if your program has an interview, really showcase your wonderful personality, because I'm sure everyone has unique gifts and abilities, and just showcase like your true self. Like, if you are silly and funny, like, just do it. Like me right now, like, I try to be as professional as possible, but best believe, like, I'm not always like this. So just be your true self, like, showcase your genuine, your humility, your sincerity, your funny, quirky personality, because that'll really like transcend.
That's great advice. Thank you. The next question is, how has COVID impacted your job and what have you been able to do?
Oh my gosh. Okay, so working as a new grad OT during a pandemic, bruh, um, definitely wasn't in my imagination. So we wear like the PPE gowns. I'm sure that you guys have seen those. So we wear those especially during our feedings, because I work with a lot of kids who have like feeding and swallowing issues. So we wear the PPE gowns. We actually double mask. So we don't just use the one N95 mask. We wear the N95 mask, and then on top of it, like a disposable mask or a cloth mask. And then of course, proper sanitizing, like, washing your hands after each client. That's already been a given. We've also established protocols like doing temperature screenings, doing a health screening questionnaire, asking each family before they come in, like, have you been exposed to COVID? Is anyone currently feeling sick at home or traveled outside the community? So we always ask those questions before they come in. Also at my work, we actually have like these like shower curtains to act as barriers, so we can section off our huge therapy gym, because we cannot have our kids interact with each other because of COVID. And also our parents, we only allow one parent at a time. Like, yes, we like, because I work with like 8 other therapists, so we'll have like 8 different families present during session, right? But we only have at least one parent inside. Like, we can't have both mom and dad show up, because we're trying to limit, like the exposure and stuff. So it's been interesting, and it's a lot of like, cleaning, and a lot of extra work, like getting, I've also been already vaccinated and stuff. So a lot of extra precaution we take at my facility, and I'm glad that we do, because we want it to be as safe and as clean as possible for everyone.
Thank you. Something that you did mention earlier was different certifications you can get, are they done at separate institutions, or can they be done while you're pursuing a master's in OT or a doctorate in OT?
Yeah, so the specializations that you guys are interested in, most of them are actually online. So there's, I can't think of the websites in my head, but there's a lot online that you would do. Yes, pre-pandemic, some schools like random universities would host it, like NYU would host it, or I don't know, some random colleges. But most of them are all done online, so you just have to complete the specialty course, and it's pretty lengthy too. Like they're like days on end to complete it. So once you do that, you would be, and you pass the test, then you would get certified. Like I know, oh, actually my program, West Coast University, my professor actually is a certified neuro specialist, so he actually has his own course for the certification to be a neuro specialist, and that's like a 2-day weekend type of deal, and they are also pricey. So hopefully this is a tip for you guys. Wherever you end up working, ask the employer if they compensate for like advanced certifications, because you don't want to pay $1,500 out of your pocket. So hopefully your company will reimburse it for you.
Thank you. The next question is, what did you struggle with the most when applying to OT school?
Definitely self-doubt, overthinking thoughts. And I think a lot of us may experience that, because if it's something that, a lot of people, like some of you guys are like, want to get into med school. So I don't know, I feel like our feelings and emotions are similar. Like you're trying to get into that program. So personally, self-doubt and self-limiting thoughts is what was kind of like detrimental for me.
Thank you. What were some of the things you did to overcome those negative thoughts, and like kind of prepare yourself for the application process, knowing that you were going to have to present yourself in like the most confident and professional light that you could?
Mm-hmm. So I did a lot of venting to my family and friends. So having a solid support system. And also when I got an interview invitation to my school, I practiced a lot for my interview. I had mock interviews with my friends, so that really helped me a lot. So practicing for like interview questions, and also venting to supportive people in your life helped me overcome those self-doubts and self-limiting thoughts. And also I conduct mock interviews. So if you guys have mock interviews for OT school, you guys can reach out to me, because I also provide that service.
That's great. Thank you so much. The next question is, how often do you see a patient? How long is the patient interaction usually for?
Mm-hmm. So for me personally, I see about 7 to 8 kids a day, and they're about 50 minutes long. So that's literally direct treatment, 50 minutes, including parent education, of like basically summarizing what we did during OT, and this is what I want the parent to do at home. So I give them like homework to do. Not like written homework, but like physical homework. Like, hey, if your child doesn't know how to feed themselves, this is how you do it.
Thank you. So can you give us an idea of how long, like maybe age range, you'll work with a child? Like, would you say you see them from maybe preschool through middle school or something like that?
Mm-hmm. Yeah, so at my facility, we see kids from like 0 to 18 years old, since we are a pediatric facility.
Great. Thank you. The next question is, what social media platforms can we watch your podcast of YOT Wednesday?
Good question. So I actually don't have a podcast, but I do have Instagram posts in my MissJoanne.ot Instagram, and I have a highlight there of #YOT Wednesday. So that's where you can check it out.
We had some questions in here about, receiving loans and financial aid for school? And do you feel like after having earned your degree and being in the profession that your compensation rate is adequate to the cost for schooling?
Yes. So at least the program I went to is it's kind of expensive, but not too expensive, if that makes sense. Because I made sure for the school that I wanted to go to, like I knew that the OT salary rate is gonna be like be financially adequate enough to match my tuition rate. So at least personally for me, I can't speak for all OTs because some OTs are gonna be like, no, it does not pay enough. But like I said, everyone's different. Everyone has different lifestyle choices. So I personally think like for me right now, because I also work 2 jobs too. So right now I'm good financially. But say I only had 1 job, then I'll be like, I think I need to get more hours because with the like I said, like because I don't work with like the geriatric or like the older population. I feel like if you worked for that setting, then you'll definitely be like great financially. But say you work in another type of setting or population, like you'll be fine. But if you really want to like expedite your student loans, then you need to capitalize your income, like getting a second job.
Definitely. Thank you. Do you know personally OTs that work to rehabilitate soldiers in the military?
I personally don't, but I know there are OTs that do because I also had a clinical rotation at a veterans hospital. So I know when I was there for my rotations, I saw the OTs and the PTs work with veteran soldiers.
Thank you. Since you work with children a lot, and you said you have to focus a lot on not only the children but their parents as well. Have you ever had to deal with parents who are very difficult to work with, and how do you manage that professionally?
Oh yeah, definitely. But I understand where parents are coming from for sure because they want their kids to be to be like, I don't like saying the word normal, but of course they want their kids to do their best, right? And especially if you have a child that were recently diagnosed with something really like disheartening for the families, parents are in denial, right? So I try to understand where the parents are coming from, and like I also, if they're difficult with quote unquote difficult with me, I do a lot of parent education with them. So if the parent is in session with me and the patient, because a lot of my families do that, and I love it actually. I'm already providing a lot of parent education on why I'm doing certain things with them. Because not only does it validate my clinical reasoning skills, but it also educates the parents like, I'm not playing with your kid puzzles for the sake of playing puzzles with them. No, there's reasoning behind why we are doing certain interventions for your kid. Like for example, like we're completing like a puzzle set, and I've had parents that say like, oh, like so you just work with puzzles all day? Like no, I provide education of like the clinical reasoning of why we are completing this particular activity. So if I ever have a difficult parent, I do a lot of parent education, and I honestly love it. Because teaching is actually like one of my passions also. So I have no problem dealing with difficult parents.
Thank you so much for that answer. Sorry. Let me give you one more question.
Yeah.
So
I'll go ahead. So the next question
Yes,
is, what is the
thank you.
best internship program for undergraduates who want to become an occupational therapist?
Oh, I don't know about best, but I feel like every opportunity that a student gets anywhere is going to be valuable. Because like I said, diversify your volunteer opportunities everywhere, because the admissions committee is going to see, like, you know, like they want to see, do you have a general idea of how to interact with different populations?
Thank you so much for this amazing presentation. I just wanted to ask if you have any last advice for our students.
Any last advice? Definitely keep, like, I know with online school is hard, but I feel like you guys are really, really resilient and courageous for sticking through this, especially during a pandemic. And, you know, just know that you guys are literally like doing your best every day, and you're showing up, and you know, you are achieving your dreams, even though it might seem like everything is stagnant, like, am I ever going to go to my desired program? But, you know, just keep showing up and keep doing your best, and then years from now you're going to look back and just be like, wow, I did all this, and literally everything is going to be meant to be, that's for you. Oh, I can't hear you, Nina. Yes. Oh, no, you're low. Okay, now we can hear you.
Okay, thank you so much. I'm so sorry about that. I do have a pretty old computer, but for all of my students who are interested in getting a certificate that verifies their virtual shadowing hours with us today, I do have a short presentation for you guys where I'll go over how to do that, as well as our upcoming virtual shadowing sessions. But first, just go ahead and take a moment to reflect on today's session. Like our professional was saying, you know, you're gonna write your professional or your personal statement when you're applying to these schools. You wanna kind of recognize, you know, why did you join us today? What part of today's session really resonated with you? And what are some key takeaways that you are going to, you know, take along with you on this journey from today's presentation? So this is all for you. You guys don't
Oh, Nina, we can't hear you.
I'm not sure why my audio keeps
now you're good.
Thank you so much for keeping me in the loop with this. Yeah, I'm not sure what's going on, but just go ahead and let me know whenever I cut out. So yeah, if you guys are interested in submitting any of these articles, reflections, reviews, or success stories, you can do so on our website.
Hey, Nina, I think you might be covering something, so if you want to take your hands off the microphone.
Is that?
Yeah, that's good.
Okay, thank you. Alrighty, we are taking applications to join our student team. So if you guys are interested, you can apply on our website. This is a 100% remote opportunity where you have the chance to meet with both like-minded students and professionals in your potential field of interest. There's a lot of support. You can get mentors just from being on the team. You make some wonderful connections with people all across the globe. This looks great on applications. You can put it on your CV, resume, LinkedIn, all of the above. So if you guys are interested, you can apply on our website, and we understand that you guys are all pre-health students. You know, time is of the essence. You might not have that much to spare, and we totally get that. But if you are still interested in getting involved with pre-health shadowing, we do have volunteer opportunities where you can work from home for as many or as few hours as you would like. We do have asynchronous opportunities as well as live hands-on opportunities where you can work in a group with other students, or you can work all by yourself and help us with outreach and professional nominations. So if you guys are interested in this, you can sign up on our website, prehealthshadowing.com/volunteer, and take a 45 to 1 hour training. And after that, you can help out with whatever you'd like.
Yes. We can't hear you.
Oh no.
Oh, there, we got you.
Okay, thank you. If you guys please could scan this code, you guys can actually get virtual volunteering hours for this just by sharing our GoFundMe link. So if you guys are interested, these are super easy hours. You can help us grow our program and keep pre-health shadowing both accessible and flexible, free for all students everywhere. And so please ask your family to donate in support of your health education, as well as anybody who would be interested in seeing you thrive in your potential career path.
Yay.
We do have some mentorship opportunities, like I stated in the beginning. If you missed it at first, this is a 3-day event on February 19 to 21, where you'll have the opportunity to network with up to 6 established professionals in your potential field of interest. This is by invite only, and so if you are interested in gaining an invitation, you can sign up on our website. We have some more information if someone could drop that in the chat for us. It'll take you to a page on our website that details everything that you need to know, how to post, where to submit, and it's that easy. So all you have to do is turn in this bingo board full. It's worth $136, and this will help us keep our program flexible, free, accessible for literally everybody who wants to join in. Go ahead and tag us at Pre-Health Shadowing and use the hashtag Pre-Health Shadowing on social media whenever you do anything cool. We would love to hear about it, and we definitely support our students. So if you're looking to get featured, this is a wonderful thing that you can do. We are active on TikTok, Instagram, Facebook, and Twitter. You guys can also get virtual volunteering hours for making content for Pre-Health Shadowing. So if you are like a viral TikToker and you want to bring your skills, we welcome you to that. You can actually get virtual volunteering hours for that. All right, here are some upcoming sessions for next week. We got a nice week out for you guys. Here are the first 3, February 1st, 2nd, and 3rd. You can register on our website, prehealthshadowing.com/sessions. And last but not least, to take the post-shadowing assessment and get your certificate that verifies your virtual shadowing hours with us today, you are going to go to our website and find Johan Gutierrez's page on our website. You will see a little picture. To the right of that picture, you will see this button that says free, take this course. Click that, you will have 30 minutes and 2 tries to get over a 70% on the post-shadowing assessment. Once you do so, you must click Finish Course. Once you click Finish Course, you will be able to download your certificate immediately. You can also find it at all times in your profile under the Certificates tab. If you guys have any questions about this or experience any technical difficulties, feel free to email us at info@prehealthshadowing.com. Thank you all for joining us today, and thank you again for all of the support from both our professionals and our students. We would not be here without you guys. This is the end of our virtual shadowing session today. Have a wonderful weekend, everybody, and we hope to see you next week. Thank you.